So we're going to continue with your assessment. Sorry for the interruption. Nagubaang ako ang pag-record, char. Okay, so we will proceed with your airway patency. So let's go back to, let's set our mind to your neurologic system. So airway patency, or particularly in your cerebrovascular accident or your stroke. So what is the problem? We have your airway patency. So what happened now with your airway patency? As we have studied in our human anatomy, your oxygen comes from your lungs to your heart. Then it will be distributed to your whole system via your aorta, your big host called aorta. So while your blood coming from your system will go to the right side of the heart, particularly with your right ventricle, to your lung to get your oxygen. So, balik-balik-balik lang na siya. Balik-balik lang process. So, remember our thickened blood vessel. And then, remember, why is it thickened? Because of deposits of your fat, your calcium, and even some of the microorganism. And we have also your smoking, diba? And so what will happen now to the blood flow? So it will become slow because the blood flow is slow. So the gas exchange of that certain individual will then be poor. That is why there will be poor breathing process. So you have to check for the airway patency if he is suffering from difficulty of breathing. And then we have also slow bounding pulse. So as what I've said, balik na punta. So thickened blood vessel due to your deposits of fat, calcium, and all. So, yun na po. And you have Cheyne-Stokes respiration. So, Cheyne-Stokes respiration, this is your type of respirations related to shortness of breathing. You just do the research, or even you try to search the YouTube on how does this type of respiration sounds. Next is your hypertension. Of course, it is normally seen with your patient that has cerebrovascular accident to have your hypertension. Bakit nga? The blood will exert more pressure to the walls of the vessel that has deposits of fats, deposits of calcium, and deposits of your nicotine and all. Okay. And then the person suffers from headache, nausea, and vomiting. These are signs of impending stroke. This headache, nausea, and vomiting. And sometimes also this also includes your dizziness and your vertigo. So vertigo meaning, ano ba yun? It is also related to your dizziness. Dali la siya out of balance or malipong ang client. And when you have number 7, we have your facial drooping. So, when you say facial drooping, this is very much evident na that the person already suffers from stroke. I have this before since I have suffered from Bell's palsy. I suffered from a mild stroke way back again, that is 2002, when I delivered, 2001, I guess, when I delivered my first baby, when I'm about to deliver my first baby, I did suffer from mild stroke. And so that is why I have facial drooping, particularly the name of this this disease is your Bell's palsy, but it's related to stroke. Another, we have your knuckle rigidity, or what do you mean by knuckle rigidity? This is somewhat related to parang yung sinusitis ba? Yung bang feeling mo maraming laman yung ilong mo. You cannot blow it out. So knuckle rigidity and decreased sensation to pressure, heat, and cold. Ito yung knuckle rigidity, pwede pa siyang maging sign ng stroke. But this decreased sensation to pressure, heat, and cold, this is already on the disease process of stroke. Na-diagnose ka na nito na may stroke ka, you suffered from stroke. Bowel and bladder dysfunction, depende po sa affectation ng stroke, ha? Diba, we have your affectation of our stroke. It could lead to paralysis in some ways. Pwede siyang maging right side or left side paralysis. That is now your hemiplegia. Upper or lower paralysis. That is now your paraplegia. Diba? Or pwede ring yung quadriplegia or 4 parts or 4 sides is being affected. Okay, so depende pag bowel or bladder dysfunction, possibly it is concerned with your paraplegia. Okay. And of course, as we have said, paralysis. So next is aphasia. So your aphasia could possibly is divided into 3. We have your expressive, receptive, and your global or mixed. Aphasia meaning the client has difficulty or problem with your speaking. So expressive if the client understands what is said but is unable to communicate verbally. The client is unable to express. I remember before the uncle of my husband, I think he has what they called, he manifests expressive aphasia. Why? Because the word that he uttered the most when he wants something or he needs something is only adiser. I remember that very word. Why? We are trying to we are that puzzled as to what he wants or what he needs because the only word he utters is adiser. That is the problem of the person who suffers from stroke. He have this aphasia expressive, meaning he cannot express. Okay. So next is receptive. Receptive meaning from the word receive, diba? The client is unable to understand spoken or often written words. So, mas grabe siya. Kaya dili na dyan siya makasabot. Okay lang tong expressive, kaya makasabot siya, dili lang makasturya. And we have also the third one, we have your global or mix. This is a aphasia or aphasic wherein there will be language dysfunction in both the areas of your expression and reception. So, ito yung pinaka-worst among the 3. So, of your aphasia. And then next also we have your ataxia. Ataxia, we have gait patterns abnormality. Gait meaning walking, di ba? Kasi depende yun. Pag hemiplegia, example, hemiplegia right, so you would notice that the right leg is medyo mabagal siya or nasa, ano tawag yun? He could possibly drag the right leg. Ganon. Or, hindi po siya makamove yung right leg. Kailangan lang assistance. So, and number 14, blindness, as what I've said, depende po sa affectation ng CVA. So, kung occipital part of the brain ang may blood clot, so, occipitus meaning it is concerned with your eyesight. So, it possibly leads to blindness. And they have dysarthria and dysphagia. Dysphagia means loss of a difficulty in swallowing. Diba? As what I've said kanina, depende po sa affectation ng brain, concerned with the different activities of daily living. So, dito naman, 16, yung pag-swallow ng individual ang may problem. Yung kanina, yung sinabi natin, may bowel or bladder dysfunction, pwede na hindi siya makaihi o basta-basta lang siya nakaihi, or the patient has no control over urination or even your defecation, yung number 10. This time, pag-swallow naman ang problema. And number 16, speech changes. As we have discussed, we have aphasia. The patient or the client is aphasic, so he might have expressive, receptive, or global or mixed aphasia. And we have also your emotional changes. And I'm not familiar with this papillodema. Maybe I happen to mistype this one. I will just check. And diplopia, I think this is pupil edema. I-check ko yan. And next, diplopia or double vision, and nystagmus, that is your rolling of the eyeballs. So, you try to remember those mentioned. So, management of aphasia, one is provide repetitive directions. Okay. So, kailangan mong i-repeat yung sinasabi mo sa kanya. And I guess you might utilize sign language. Break tasks down to one step at a time. So, do not overload. What do you mean do not overload? Hindi pwede na marami kang sinasabi, marami kang enumerate na activity na gagawin dun sa patient. Kailangan, when you're going to do something to the patient, you're going to do it after. Not overload the information, such as example, hi, good mom, good morning, I'm Irene Lim, we're going to brush your teeth, and after that, we're going to take a bath, or mom, we're going to eat, and then we're going to brush our teeth, then take a bath, and after that, watch TV, and then you sleep. No! You have to make it one step at a time. Then next is repeat names of objects frequently used, of course. Okay, bakit? Remember, just like yung Alzheimer's, din po yung handling natin dito. Kailangan nating i-emphasize kung anong na-remember pa ng client. Okay. Then, use of picture board or communication board, especially if kung grabe yung affectation ni stroke, itong C and D. Management, immediate care, maintain patent airway. If there's difficulty of breathing, dapat walang obstruction, di ba? So, when you say halang obstruction as a caregiver, dapat we're going to clear the nose. How would you clear the nose? Make sure wala po siyang thickened mucus. Or sa Bisaya, kugmo. Okay. And basic lang naman yung gagawin ninyo as a caregiver. Then additional, if oxygen is required, so you put on the oxygen, nasal, or nasal cannula. Letter B, you monitor the vital signs, especially if it's post-stroke. After the stroke, usually stroke will going to recur. So this way you have to monitor vital signs, and you take the medicine religiously. Monitor for increase ICP, meaning intracranial pressure, because remember our signs of signs of stroke, we have headache, diba? Headache, nausea, and vomiting. So pag masakit ang ulo ng client, dapat you will not take it as a joke, but of course you have to take it seriously. Position the client on the side of the head, on the side with the head of the bed elevated to 15 to 30 degrees as prescribed. So, dapat naka-sideline position ng patient. Pwede rin mag-faller's position. Usually, mga 45 degrees faller's position. So, we have maintained a quiet environment and provide minimal handling of the client. So, dapat no interruption. Maintain proper body alignment, of course. Dapat lang, kahit sino, kahit hindi pa stroke. And keep side rails side rails up. Bakit? Because remember, even if the patient cannot move a part of his body, let's say kung hemiplegia, you should not be, you have to ensure safety to the patient or to the client. Next, we have to be prepared to administer medication as prescribed. This is not our job description. But in case that you are already handling the patient for several months or years, so you are already knowledgeable about the medicine of the client. Intermediate care and rehabilitation needs continue implementation of immediate care. So, lahat-lahat na yun, dapat i-continue. Position the clients 2 hours on the unaffected side, 20 minutes on the affected side. So, position daw ang client 2 hours on the unaffected side, 20 minutes on the affected side. Bakit? Kasi we're going to continue ha. Position the client in the prone position if necessary for 30 minutes, 3 times a day. That is, this one is, it is going to encourage circulation of blood. And of course, kasi 2 hours ka on the unaffected side, so maging side lying ka, di ba? Siyempre, kung left hemiplegic ka, so pwede kang unaffected side. So dapat you were going to sleep side lying on your right. So okay, 2 hours. Pero pag 2 hours, so dapat sa ilalim yung unaffected. But 20 minutes on the affected side. Okay. Bakit? So, this is also for the circulatory reason. Dapat yung circulation natin, kahit hindi naman siya, kahit may paralysis, we're going to encourage circulation in the area so that it will also encourage blood, as what I've said, blood flow on the area or circulation in the area para din mag-function yung mga nerves, diba, naapektuhan. Letter D. Provide skin, mouth, and eye care. So, depende again has affectation. Pag yung mouth or the eyes na part or yung face, yung affected, just like what I am saying before, my case, your Bell's palsy. So, of course, you have to provide eye care. Perform passive range of motion exercises. As we have discussed, it doesn't guarantee that it will help it will cure the illness, but of course, at least it will going to improve circulation. And monitor the gag reflex and ability to swallow of the client. Remember our problem, your dysphagia. So that's why we have to monitor this. When eating, position the client sitting in a chair or sitting up in bed with the head and neck position slightly forward and flex for better swallowing naman yung rationale nito. Letter H, place food in the back of the mouth or in an affected side to prevent trapping of food in affected cheek. Yes. Kasi as per experience, with my Bell's palsy, I don't have any difficulty in swallowing, but due to the paralysis, the front area of the mouth has this difficulty to, it has difficulty to move the food to the innermost part of the mouth, especially drinking water. It's very hard. Next, we have also your approach the client from the non-affected side. So, in this case, approach the client in the non-affected side. This is post-stroke. So, right after the stroke. So, non-affected dapat mong i-approach yung client kasi let's say, hindi naman siya makarespond. So, for example, mag-offer ka ng pagkain. Pag sa left side ka nag-approach, tapos left side ang paralysis. So, mahirapan siya. You're going to twist his body to get your food. Diba? So, you have to approach the client non-affected side first. But during the rehabilitation stage, so you may approach the client to the affected side na. Place the client's personal objects within the visual field. So, dapat makita niya yung mga personal niya. So, makita niya agad-agad. Example, left hemi. So, you're going to place it on the right side. Para makuha niya yon. Okay. Agad-agad. Instruct the client with visual problems to turn head from side to side. So, basic yun po. So, increase mobility as tolerated. So, walking can help. Encourage the client to express feelings. Kung gusto niyang umiyak, pwede. Para sometimes the clients magod fake their emotions because they hated that you're going to witness them on their down moments. Kaya they try to become that strong and yet they're faking. So you have to encourage them to express. And then encourage fluids in high fiber diet. Remember, ang problema natin, hindi yun, di ba, yung mga poor defecation, di ba? Especially kung affectation is the lower part ng body. So, that's it. So, kailangan mong mag-increase fluid intake. And even the worst, you administer stool softener as prescribed. And encourage independence in activities of daily living. Yes, especially the normal reaction of the individual with this paralysis, they don't want to be of help. Normal reaction niya ng tao, ha? They don't want to be considered as worthless. So they want to claim their worth even with a certain condition. And then assess the need of assistive devices such as cane, walker, splints, or braces. Of course. Diba? Pinag-aralan na natin sa disabled care niyan. And then teach transfer technique from bed to chair and chair to bed. And of course, we have providing gait training. What do you mean by gait training? Yung walking training, diba? Pag kailangan niya yung cane, sasabihin niyo, ma'am, yung cane po, dapat opposite po siya sa affected side, diba? Or pag walker naman, sabihin naman natin kung pwede niyang gamitin yung non-weight bearing, hindi non-weight bearing, amputee, hindi. Pwede siyang gumamit ng partial weight bearing or you could walk slowly using the walker. Even though he might look like as if he's dragging his foot, diba? So that's it. We will proceed with your Parkinson's disease. So Parkinson's disease, Parkinson's is a progressive neurologic disorder affecting the brain centers responsible for the control and regulation of movement. Asa siya dapit sa brain, particularly in your frontal part. Dito sa imong bunang dako. So, if that is affected, that is responsible for movement, then you will have Parkinson's disease. Anyway, this is also degenerative disease, or meaning it affects aging individual. The debilitation can result in falls, self-care deficits, depression, and failure of body system. Mental deterioration occurs late in the disease. So, mas grabe siya, diba? Kaya mag-deteriorate talaga yung client. So, assessment, rigidity and slowness of movement. Rigidity, magahi siya, and then slowness of movement, hinay, and aching shoulders and arms. So, and you have to imagine that gahi ang iyang muscles. There is rigidity. So, it will end up to aching shoulders and arms. Bakit? Ikaw kung mangusog pila ka oras or pila ka, di ba? Hours and even days. So the tendency, of course, you're going to have aching shoulders and arms. And next is monotonous speech. They cannot talk properly. Handwriting that becomes progressively smaller, magkagamay, or mura siya pill rolling, o tremors in the hands and fingers at rest. Pag walang ginagawa, mag-tremors, magkurug-kurug ang kamot, o especially when at rest, meaning walang ginawa, or term as your pill rolling. Ang imong thumb o index finger, iana nimo, lingin-lingin, murag pill rolling, i-roll. Then tremors increasing when fatigue and decreasing with purposeful activity or sleep. So, Tremors kuno magagabi kung nag-fatigue ang client, pero mo decrease lang siya kung may activity. For example, na siya gunitan, dalon. And then, asahon. So, decrease ang tremors. Or, matug. Diba? Restlessness and pacing. Ang client with Parkinson's. Blank facial expression. Drooling, magtulo-tulo ang laway. And number 10, difficulty swallowing and speaking. Yes. And loss of coordination and balance, and shuffling steps to position and propulsive gait. Okay, propulsive gait, maglisod jud siya glakaw. Pwede siya mura siya robot. I have seen one in the office of the LBC before. He was about to claim money. Kay dili man makaklaim tong uban kay siya man ang nakapangalan sa money. So, ang tendency, he went there together with her apo. Gabi, luoy kay siya, drug na jud siyang tiil, padulong dito sa counter. Og naluoy ang taga-LBC, iyang gipalingkod ang tigwang with Parkinson's. He was from Tinago siya. Management. Provide high-calorie, high-protein, and high-fiber soft diet with small frequent feedings as prescribed. So, sige-sige pagkaon, bahala o gamay, basta sige-sige lang. Okay. Kay, he needs lots of calories and for energy, kay magkurug-kurug siya. And high protein, high fiber also. Then, increase fluid to 2,000 ml per day and less contraindicated. Bakit contraindicated? Kung may heart problem, so mako-contraindicated po si fluids. Kasi dapat i-limit natin yung fluids, especially kay yung fluid natin, maka-result siya to increase cardiac output. So, mag-overload si heart. So, pwede siya magka-problema with your heart disease. Pwede siya mag-CHF or congestive heart failure. Avoid rushing client with activities. Kay gahi kayo siya. What do you mean by gahi? Nag-tremors biya siya. Diba? So, lisod kayo niya i-move accordingly. Assist with ambulation sa paglakaw. Provide assistive devices as needed, usually walker. And instruct client to wear low-heeled shoes. Of course, ginoo ko, Parkinson's siya, di pwede mag-high-heeled. And encourage client to lift feet when walking and to avoid prolonged sitting. Yes, dapat avoid prolonged sitting. Kasi pag atras siya, pag nag-sit siya matagal, mas sobra yung tremors, diba? And provide a firm mattress and position the client prone without a pillow to facilitate proper posture. Oh, di ba? Kaya naman siya tendency ma-stop, di ba? In our, here in our signs and symptoms, here. Oh, di ba? Na siya tendency nga ma-stop siya. So, kailangan natin na, ano yung, niya, walking, yung posture. And then next is we have instruct proper posture by teaching the client to hold the hands behind the back to keep the spine and neck erect. Yes. Especially kahit hindi Parkinson's. Everybody should do this. Okay. Especially to stretch your back. Monitor for constipation. That's why we need to softener, diba? Instruct, tapos we need high fiber. And instruct client to take medications as prescribed. Offer realistic reassurance and psychological support. What do you mean by offer realistic reassurance? Dili jud kami nga maulian ra kanay kadugayan. No, because it won't happen. Impossible. Only God knows. Muna unsa naman siya? You have to make sure that the client is not comfortable. And psychological support the client. Make sure that you were going to relay information to the client that you understand the situation, even you did not, diba? So, dapat ang emotional support natin, dapat ready. Keep patient as socially active as possible, diba? You could join other patients even without Parkinson's. And next disease, we have your Alzheimer's disease. This is an irreversible from a senile dementia from nerve cell deterioration. So, it affects aging individual also. What do you mean by irreversible? Hindi na po siya babalik sa dati na ma-remember niya lahat. usually deteriorating po yung Alzheimer. So, assessment, individuals with this disease experience cognitive deterioration, makalimot siya, di na siya kadumdum and all. Pag may Alzheimer's, usually ang malimtan niya ang bag-o nga situations nga ihatag. Example, ningin mo gatas, dili siya makabalo nga ang gatas ning agi sayang tilaok, di ba? That is true Alzheimer's disease. Progressive loss of ability to carry out activities of daily living. So mo na management, you have to make reinforce the information being retained. Mo na imong management again. A steady decline in physical and mental functioning. So that's it. Oh, steady decline, meaning magka-deteriorate jud. Physical and mental functioning. So, usually, mukha tayo, ma'am? Possibly, in the later stage. Usually requires nursing home placement in the final stage of illness. But for me, as long as there is a strong support system, ug may caregiver nga mag-alaga, pwede siya makastay sa house. Kasi for me, mas mag-deteriorate siya kung nasa sa home placement. Management, identify and reinforce retained skills. Diba? As what I've said, provide continuity of care. So, continuity of care, dili pwede mag-ilis-ilis so caregiver die. So, dapat si caregiver, pwede 1 and 2 lang. Hindi pwede 1, 2, 3, 4, 5. Change ang caregiver, dili. Kaya masabot siya o mag-deteriorate ang iya mental capacity. Orient to the environment. So, do not change environment also. Dapat the same lang. Especially the placement of the things, belongings of the client. Furnish the environment with familiar possessions. Diba? That's what I've said. Acknowledge the client's feelings. So, if the client cry, acknowledge it. If the client is angry, you have to acknowledge it, diba? All you need to do is to ensure comfort, diba? And safety. Number 6, assist the clients and family members to manage memory deficits and behavior changes. Okay, so self-explanatory man na. Encourage family members to express feelings about caregiving. Kaya usually pa lang family members man gudang mag-atiman, pag mag-alaga sa client, ang tendency nun, ay mag-away silang lahat. So, better may caregiver para free silang lahat sa stress. Pero, mas stress po ka sa bayad sa caregiver. Pero, okay na lang kasi ikaw yun ang mangunay. Then, provide caregiver support and identify the resources and support group available. So, na mga group sa parehong may Alzheimer's na family member, di ba? Monitor activities of daily living. So, dapat structured po ang activities daily living natin. Hindi po pwede change. So, for example, at 6 a.m., pakainin mo, 6 a.m. talaga, pakainin mo na. And then, for example naman, mga 7 or 8 o'clock, ipaligo mo. So, 7 o'clock, 8 o'clock talaga ligo na. Para ma-retain po yun na information sa client para hindi mawala. As much as possible, also you may use a clock training. What do you mean by clock training? The activity of the client should be referred to the clock with a picture of the client on it as per hour. Nga no? Para makita niya yung sarili niya dun sa picture na, 6 a.m. ako yan, kumakain, so dapat kakain na rin ako. Parang ganun. And we have also remind how to perform self-care activities. Of course, dapat kung after meal, dapat nakatoothbrush talaga siya. Para hindi niya makalimutan mag-toothbrush. Maintain independence. You allow the client to do the procedure himself as long as you are there present. Provide consistent routines. As what I've said kanina, you may refer it to the clock. And then, provide exercise such as walking with an escort. Yes, baka mawala. Avoid activities that tax the memory. Oh, what do you mean by tax the memory? Yung masyadong nag-isip, sabihin mo, sino yung kapatid mo? Ha? Anong pangalan? Sabihin mo. So, Diyos ko, mag-tantrums yan. Kasi, bakit mag-tantrums? Kasi he hated the fact that he cannot remember his sibling. Yun. So, do not avoid activities that tax the memory. Or, sabihin mo, 100 plus 105. Nah. 1,275 plus 135. Si answer. Sus, ginoo ko. Ayaw, jutawan buhatan na. Allow plenty of time to complete the task. Yes, dapat ha. And use constant encouragement and step-by-step approach. Anyway, in dealing with the Alzheimer's, you are dealing with a baby. May appreciation ka dapat for accomplishment. So, clap your hands. Provide activities that distract and occupy time, such as listening to music, coloring, and watching TV. Kasi, power siya mag-isip na makakalimutin pala siya. Okay, next, we have also your provide mental stimulation with simple games or activities. So, simple lang. Provide a safe environment as a must. Use a firm volume and low-pitch voice to communicate. Yes, hindi pwedeng shout ha. Kaya remember, pag Alzheimer's, usually, it affects the elderly. Diba? Yung elderly natin, pag malakas ang boses na bibingi, dapat low pitch voice. Call client by name. Yes. Ask only one question at a time or give time. And remove toxic substances from environment. Yes, dapat ha. Kasi yung mental ability niya to choose or to, ano ba yan? To decide o ano pa, to assess and all is already having a problem. Prevent shadows in the room. Okay? Masikain niya abat to. Use touch gently. Oh, yes. Anybody, kahit hindi Alzheimer's, you have to use touch gently. Hindi pwedeng basta mo lang hawakan yung isang tao kasi depende sa paghawak mo. Depende sa culture din yon, di ba? Yung mga Arab, ayaw nilang hinahawakan sila, di ba? So, ayaw nilang tinatapi sila sa balikat, di ba? Pinoy lang ang may ganon. So, next, specimen collection na po tayo. So, specimen are a small amount of body tissues or fluids that are collected for examination and analysis in the medical laboratory. Anyways, we have already discussed this one in our return demonstration, diba? We have your urine, stool, sputum, and diba? And your feces. Stool nga, di ba? Yung mas specimen. Ang tawag sa kanila, specimen. Tests are performed to evaluate the health organ system, yes. Determine the course of illness, yes. Kasi pag may problema sa sputum, so may problema ka sa respiratory problem. Ito yung dalawa, evaluate the health organ system. Identify infecting microbes, especially respiratory and feces pod, meron. And UTI, meron. Diba? UTI, your Escherichia coli, UTI na. Sa microbes, you have tuberculosis or tubercle bacilli, that is your TB. And your sa stool, malaman natin kung may parasite ka doon, di ba? And also other microbes. And next, evaluate results of treatment. Kasi pag nag-treatment ka ng SCC kit or your short course chemotherapy for tuberculosis, definitely the next after your treatment, pag effective yun, wala na yung TB, so 6 months ka lang mag-short course chemotherapy. Pero after evaluation, another sputum exam, nandun pa rin si TB, so yung 6 months short course chemotherapy nyo po, magiging 1 year siya, diba? Para talagang mamatay yung microbes. Observe client's progress. O, diba? Para malaman natin kung may progress pa siya. Kasi, for example, na-diagnose ka with urinary tract infection. Excuse me ka. Tapos, nag-underwent ka ng treatment. Pag underwent mo ng treatment, so kailangan i-re-evaluate. So, mag-urinalysis ka ulit. Para malaman natin kung wala na ba si wala na ba si microbes doon, di ba? Or clear na ba yung urine nyo po? Check for presence of abnormal substance, chemicals, or drugs and cells in your urine, sputum, or your feces. And general rules for obtaining and handling specimen. We have follow agency and directions for collecting specimen from client. Complete all information requested on the label, such as client's name, address, date, and time specimen was collected. Be sure all information is spelled correctly and is readable. Of course, basic mo na siya. Collect the specimen at the time specified and use clean container for specific specimen. Hindi pwedeng halo-halo ha. Dapat isang specimen, isang client. Follow directions for storing the specimen. Yes. Dapat i-follow. Dapat yung feces mo ngayon, dapat isubmit mo ngayon. After mo nag-defecate. Hindi yung feces mo ngayon, today, isasubmit mo bukas. No, hindi pwede yun. And just like your urine and your sputum also. Inform the client or family members where the specimen is stored. Of course, dapat malaman na kasi baka maano nila, 'di ba? Possibly ma-mistake nila na ma-open pa nila. Follow the agency's instruction about sending the specimen to the laboratory. So we have this one, your routine, clean catcher, midstream, and 24 hours. We have this one already in our return oral your individual conference. So, routine, collected anytime client void, clean catch, collected to determine presence of bacteria, while 24 hours is collected to evaluate the body's elimination of certain chemicals and hormones, and specimen is stored in the refrigerator or a bucket of ice to prevent from growth of microorganisms, and sometimes preservative may be added. Okay. And your stool, you collected laboratory examinations for presence of blood, choo-choo, and all. And then you have your sputum. Okay, we have there to check for presence of blood, bacteria, and abnormal cells, sputum, mucus, secretions from the lungs, for your saliva. We have already discussed this one. Saliva, clear liquid secreted by the salivary gland, and your hemoptysis, presence of blood in the sputum. Okay, that's it. Hemo means blood. Okay, so we're going to stop here. We're going to continue with our musculoskeletal system next.